Hello, Joe Uhan here again, talking about nerve mobility, and in this video we're going to talk about upper quarter, neck, and arm mobility. So as I mentioned in the first video, we have three main nerves that go into the arm. You have the radial nerve, which kind of goes on the radius bone sort of in the front of the arm, curves around the back of the upper arm, and then goes into the radius bone where the thumb is. You have the median nerve, and the median nerve kind of goes more in the front of the elbow into the bicep. And then the ulnar nerve kind of hooks around the elbow here and goes into the kind of pinky finger area. So all of these nerves originate at the neck, right about kind of here into the shoulder. That's what is called the brachial plexus. The associated, all these different nerve levels sort of coalesce into these three main nerves, and then they pass through kind of underneath this tissue, like over the rib and underneath the shoulder blade down into the arm. So talking about, okay, well, if I have arm pain that doesn't seem to be responding to stretching or strengthening like it's a sore muscle, I may have nerve pain. And how we can attest for that is by doing nerve mobility. So here are three kind of nerve mobility tests. So if we want to test the radial nerve, we put our arm at our side and flex our fingers in. So that puts that radial nerve in tension around the corner. And then you slowly bring it up. And normal for most people is the ability to bring the arm to about 90 degrees without feeling an excessive amount of tension. It's one thing to feel a little bit of a stretch, but to feel really strongly tight or get tingling or symptom replication, that means that you're testing positive for a significant amount of nerve tension. So that's radial nerve. Median nerve is similar with a straight arm, but you're going to kind of supinate or open it and then extend the wrist and then slowly bring the arm up like this. So again, we should be able to get to about horizontal or 90 degrees of shoulder abduction and not have significant symptoms. And again, we're looking for extreme stretch, tingling, especially down in the hand. The last one is the ulnar nerve, and to do this one, you make the OK sign, and then you slowly lift up. And for this one, you want to get at least 90 degrees with the fingers towards the head. So whether or not you have something in your upper extremity that's relevant is going to depend on, do you have pain that's not going away in this area? And then are those symptoms replicated during that test? So for runners, this is pretty rare, but running is really important to have good mobility here, because when we swing our arms, that arm and that shoulder blade has to swing forward and back. And if there's tension anywhere in this system, you can get neck pain, chest pain, back of the shoulder pain, or pain anywhere down the arm because you're trying to do a normal thing like swing your arm, but for whatever reason, that nerve is getting hung up. So again, go back to that analogy. You don't have enough hose to get around the corner, and now you're tensing and stretching that and irritating that nerve with every swing. So for runners, this is probably less common, but if you're having any sort of arm pain, this is really important to assess. So the easy thing with how to treat that is you go into that test position. If we go to radial nerve, let's say I feel symptoms right about here. I'm going to back off a little bit, and then I'm going to take my head and I'm going to do a little bit of a wiggle. So what am I doing when I do this? I'm taking that nerve that comes from my neck, I'm putting it on just a little bit of tension. And by doing that, you're just applying a little tensioning, stretching of that nerve through the tissue. You're not necessarily trying to increase the length of this. You're just trying to see, will that nerve flow through that tissue? There are some other things called flosses. And what that would be is when my head goes this way, my fingers go like that. That means that when I take tension here, I give it away, slack there. You can do that too, but this is a very simple starting point to just do a little bit of gentle tensioning. That's the radial nerve. Median nerve, same thing. You go into that position. There's my tension spot. I back off. I do some gentle on and off. Ulnar nerve, same thing. I lift up. I go with a little bit of on and off motion. The key to healthy nerve mobility and restoring nerve mobility is to go really gently. Nerves do not like to be stretched, and they're very sensitive electrical cables. Do it with frequency. So you might want to do something like this every 2 to 3 hours, and then be really consistent with that throughout the day, and then consecutive days until you can get to that kind of normal position without either symptom replication, your symptoms go away, or you can just kind of get that full range. Lastly, you want to make sure that your symptoms go away. So can you do this and then just feel a normal stretch as opposed to your pain? If you can do all those things, then you know that you're good. The last thing that I'll say is that if you're tying this to an activity like running, you're going to want to for sure do a little bit of this right before you run. That also includes doing a little bit of that requisite mobility to the neck and the upper back as well. And I should say that, as we talked about in the first video, you're going to have a better outcome for nerve mobility if you do the spinal mobility first. So for the upper quarter, that may be doing general neck mobility, and even doing a little bit of upper thoracic foam rolling mobility first, doing that several times a day, then following up with a little bit of your nerve mobility, just to make sure that that nerve is moving before you go do your physical activity. So if you have any sort of upper body thing, or if you suspect that you have an upper body thing that might potentially be factoring in a lower body dysfunction, try these upper body nerve stretches and see what they do for you.